Hello. Today I'm joined by Kat Kennedy, who's completed our coach training course to learn how to coach young people. So tell me a little bit about yourself, Kat. What is your role and how you came to coaching as a way of supporting young people you work with?
My background is as a mental health nurse. I've worked mostly with children in children mental health services in the NHS. And I came into coaching personally, had some coaching myself, started on one-to-one coaching and then had some group coaching, which was kind of really revolutionary for me. I've had various different um, inputs in kind of improving things in my life and helping my mental health and physical health and well-being. But the coaching style really suited me, and at that point was really beneficial. And then I started exploring, wow, how can I use this with the young people that I see? And then came across your coaching training program through some hardcore googling, and just it felt like the way that you described coaching with young people and the positive psychology just really fit what I could see was a real big gap for some of the young people I was working with. So that's kind of how I ended up having my initial conversations with you and coming on the course.
So where do you see coaching then filling that gap, let's say?
It's very much about helping them find their way and focus on the thing that they wanted to focus on. So rather than, you know, a young person's been referred to me with a problem with anxiety and not being able to get into school. And so the parents' driver is, I need them to go to school. And the school's driver is, we need them to be in school. And the young person's
Mhm.
driver is, I feel really anxious about being sick, or I feel really anxious about my friends being mean to me, or I don't like the sensory aspect of school. Like we coaching helps you find that part of the young
Yeah.
person. What's their driver.
So what kind of results have you seen then when you've been identifying these problems?
So yeah, I've got two young people that have got kind of great, like I've gone through all the way through for and I've now discharged, which is fantastic. One of them was a school finding getting into school really difficult, and it was getting more and more difficult. And they were people were finding solutions for them. So when they first came to me, parents had said, "Right, we're going to look for a different school." And I was like, "Oh, slow down because we actually don't know whether it's with what that would help." And actually, let's. But they between sessions had moved them schools. And their problem got much worse at the second school because not only did the original problem, we didn't know what the original problem was, but now they're
Mm.
also in a new school with new people and they didn't know anyone, so they didn't have any kind of safety nets.
Yeah.
Um, and actually, the turning point for that young person was the activity about how do I seek help? Um, because it made them really think about the ways that they were letting people know that they were struggling and that they felt that no one was listening. And they were really very angry that nobody was listening. And the only way people could listen to me is if I don't go to school.
Oh my God.
And actually, they'd been asking for help in their own way for months and months in their head, but they were doing it in such small ways, like complaining about tummy ache or um, avoiding homeworks or getting cross or refusing to go on trips, those sorts of things. And nobody had known that that was them asking for help.
But
So,
just if you
wow, okay.
extrapolate that out to like all these kids that are not able to go to school, I just find it quite overwhelming actually.
I was sort of really emotional in that session. And then we were able to kind of, that just filled like loads of sessions afterwards, working with her, working with parents, thinking about how she feels heard. And she just didn't feel heard anywhere, school, home, friends.
We go into rescuer mode, adults go into rescuer mode and they see the practical solutions and we just need to get them back in it. Nobody stops to ask them. And this is why coaching can work with the relationship built on equality and trust, can't it? That they actually might feel heard like for the first time and how we underestimate the
Mm.
value of that.
If I've set it up so it's a coaching session as well, so I use some of the coaching skills in my clinical work as well, and I'll talk about that later. But if it's a purely coaching setup and the young person's expecting coaching and we've framed it that way and that's how we've started, if I then slip into fixer, nursey, pet, that sort of clinical role, I can feel the dynamic shift in the room. I can feel the young person kind of go "Ruh," and put their barriers up.
What we need for well-being is autonomy, competence, and relatedness, self-determination theory, right? And if you're making a plan for a vulnerable kid who's suicidal or self-harming, extreme self-harming, or whatever, and you're not asking them what do they want,
Nope.
how are you helping improve their? You're not. You're because that's not helping them have any competence or autonomy or a good relationship with you.
Well, nope. It's literally ticking a box to cover your backside,
To stop them killing themselves, basically, in
or
some
stop being
cases.
to blame if they.
Or stop, yeah, oh my god, to stop. Makes me feel really sad, actually. I'm gonna cry. I'm laughing because I feel
It's so
really.
not designed to help young people. The system is not designed to help young people. And there's some really amazing practitioners who are doing their absolute best to try.
Yeah.
But yeah, they don't have the skills of, helping the young people find their autonomy. We're not taught that in mental health, more in nursing than some disciplines, but we're not taught it in the way of kind of, okay, stop and let them talk and explore it with them. And,
And what we're doing now as a society is leaving it up to potluck.
yeah.
Well, hopefully they'll be okay. They got to figure it out for themselves. But like most people, loads of kids, there are young people out there that have not had those extremely challenging circumstances and are not fine. So it's like, or there's like a lot of like well-to-do families, affluent neglect, and the kids are still struggling, aren't they? Just as much as I know,
Yep.
poverty and disadvantage does cause mental health problems, but it's not. Doesn't
I've worked in
discriminate mental health problems, do
Does
they?
not. No, I've worked at boarding schools and independent schools, and there is just as many difficulties and struggling children than there is in, poverty deprived school areas as well. Yeah, it doesn't
Yeah,
discriminate. And
no.
for some young people, I've had them come to me saying, there's nothing I can talk about in therapy because nothing's happened. I just feel awful, and I shouldn't. I feel really guilty that I feel awful because I haven't got this tragedy or this thing that's happened to me.
Mhm. What I'm becoming more and more interested in is relational trauma, and like I really think like the trauma of the trauma, because trauma is, it's the buzzword at the moment, trauma informed practice,
Trauma
we're all
informed
doing
practice.
trauma. But I think of like the big traumas, the big T traumas, like neglect and abuse, and growing up in a household of drug addicts and those things, or I mean, COVID's trauma, we've all gone through trauma, but I think it's the lack of trust in family or family dynamics, or the way you're spoken to, like the inner child that gets wounded, and those kind of traumas that we just leave up to chance to deal with. And
Yeah, the mum that shuts down when she's
yeah,
struggling, doesn't speak
yeah.
to someone for a couple of weeks, or the dynamics that make it really difficult in families that children get lost in, or yeah.
When we talked about the languishing and flourishing, like I'll put a diagram up here. I do that so I know to do it. Was that sort of a theory that was kind of helpful for you to know?
Really good to think about, yeah. Because there is those, and it was really useful to just put that kind of framework around it, because there are just those kids that you can't put your finger on it, but that aren't flourishing. And yeah, it was that group that get lost in the system.
Okay, so let's change tack and talk about your professional development then on the coach training course. So what do you think you've got out? I mean, if you've touched on this a little bit already, but what do you think you've got out of it professionally?
Coaching skills have been really useful in my NHS work. Um, I did a little bit of kind of inaction coaching on the ward with a young person who was really struggling. And I was kind of supporting a healthcare assistant who was struggling to know how to kind of help this young person. And they were just standing in the kind of communal area and they were turning the light switch on and off. And I think the staff had kind of gone into, this is a psychotic mode, or this person was having an OCD. Like, I think they were kind of thinking clinically why this person was turning the light switch on and off, and they were kind of making lots of suggestions at them. There's a lot of input. And I was able to say to the young person something really banal, like, the lights go on and off when you do that, or something really random. And they
Yeah.
said, yeah. And I went, how does that feel? She's like, quite like it. And then we cut, why? She's like, no, quite like being in control of the lights. I was like, oh,
Ah,
can you put
autonomy.
that thing on and off in your room? She was like, no. And then we were kind of able to kind of explore that a little bit more about, okay, so are you allowed a lamp in your room? No, because of the cables. Okay. Is there anything you can have in your room that's not a cable, but means you can control your environment a bit more? And she was like, well, maybe I've got a bubble. And we were kind of able to explore that. But what was really powerful is that the healthcare assistant was with me, watching me do it.
Mm.
And they were like, wow, that was amazing. And I was like, oh, okay. So then I was able to explain to them what I was doing and why I was doing it. And I would never have been able to do that before the course.
Yeah. So are you seeing what's some amazing impacts that you've seen with young people then? How are you using coaching to support young people with anxiety?
It's really different depending on what's generating that anxiety, I guess. And there's a real, like, for young people who've got neurodivergent, so who have Asperger's, or what they call Asperger's, autistic traits or ADHD traits, and anxiety is sort of a different approach to the young people who have got anxiety without that kind of background. And for
Mhm.
the young people that are coming to me with kind of likely to have what looks like sort of more autistic traits, it's helping them understand real basic stuff about what anxiety is. They often don't know where they're feeling it in their body or why they're feeling it in a certain way or a certain situation. So a lot of it's exploring with them about trying to work out for them whether it's anxiety or whether it's relationships or whether it's
Like sensory
density,
overload.
or yeah. So it's starting kind of really in a different way for them. And for young people who are anxious because school's difficult, relationships are difficult, they're frightened of being sick, they're frightened of, I don't know, it's thinking about for them, when are they not anxious, why, how that works, what is making them anxious in certain situations, do they know what their triggers are, um are there things that people around them can do, how do they get help for that, how do they ask for help now, how do people know that they're struggling? Yeah, it's a real exploring with them, because I think young people with anxiety come to me with referrals from parents or schools to say they're anxious and we just need it to be better. And
Mm.
young people go, I just want the thing that's making me anxious to go away. And it's trying to find a medium way for both of that, because actually the thing that's making them anxious probably isn't going to go away. Uh,
Yeah.
and I can't fix their anxiety or make them do things differently. So it's about thinking with the young person about, okay, what does work and what can help and what can they do?
I know CBT is like the go-to sort of intervention for anxiety, and we do use cognitive behavioral approaches in coaching, but I think it's the relationship that's different, isn't it? That's helping them access those different thoughts and behaviors that are more CBT based. Any last thoughts you'd like to share?
I think just that for me, this experience has brought me so much more than I thought it would. And that I was really hesitant at the beginning. I was really like, how's this going to work? How am I going to fit it in with my life? I've got 2 children and a job. This is ridiculous. Why am I even doing this to myself? I had to, borrow some money. It's all terrifying. And I'd said we had lots of false starts before doing it. But actually, for me, this process has been amazing clinically in my practice, in my NHS work with young people privately, but also personally, just thinking about myself and my career. And I would really strongly recommend people explore positive psychology and coaching and the Worth It course really strongly, because it's just been, it's been amazing for me.
All right, thanks so much, Kat, for everything today. I really do think there is a way we can integrate coaching into nursing and clinical work, the clinical world. And I wasn't aware about how far away from that we are right now.
Yes.
And
I
I
think
think,
the more the services have got into crisis, the further we've got away from it, actually.
yeah, and yeah, you can't keep doing what they're doing. It's not working. Something
Not
has
like,
to change.
yeah.
Brilliant. Thanks again for your time. I'm
Thank
gonna
you.
sign off now.